Alice. Alice is 30 years old and lives in New York City. Alice has a family history for depression, but for the most part, this does not affect her life. Alice used to have a pretty decent paying job at a bank down the block. Unfortunately, Alice got laid off a couple months back and had to take a much lower paying job. Over the past couple of months, Alice has been really struggling to pay her bills and is now considered a low-income household. Because of her newfound stress, Alice has begun to struggle with a new onset depression, and this has started to affect her personal and professional life. Alice knows she needs to seek out help for her depression, but she cannot afford a good health insurance to cover the cost of appointments, and with her conflicting work and home schedules, she could not make the appointment if she wanted to. Alice needs a solution for her real-life problem. For millions of lower-class working Americans, this is a real and prevalent issue that seems to have no end in sight. Whether they cannot afford reliable health insurance, do not have reliable transportation, or have conflicting work and home life schedules, or feel as though they cannot seek out treatment due to the stigma around mental health, people are going without the treatment they require. To speak on this endless cycle, according to the National Survey of Drug Use and Health, an estimated 9.8 million adults aged 18 years old and older had a serious mental health illness, including 2.5 million adults living below the poverty line. These individuals are also likely to face higher health care costs, decreased productivity, and poor health in general. In similar research, it was found that the poverty may intensify the experience of mental illness. Poverty may also increase the likelihood of the onset of mental illnesses. At the same time, experiencing mental illnesses may also increase the chances of living below the poverty line. In another study was done on 34,653 adults over the age of 20. The study found that household incomes less than $20,000 per year were at increased risks of incident mood disorders. In similar findings, a decrease in household income was also associated with an increased risk of mood disorders, anxiety, and substance abuse. Overall, the study found that the findings suggest that people with an income below $20,000 per year is associated with substantial psychopathological characteristics, and there is a need for a targeted intervention to treat and prevent mental illnesses in low-income households. One possible solution for this is with our increase in technology-infused society, if we use smartphone apps as a source of diagnosing and treatment. Smartphone mental health apps are being tested around the world in studies as a tool to help and diagnose patients, track symptoms, create a focused treatment based on patients' needs, and to start to apply this treatment. These apps are targeted on lower class and working individuals who cannot go to a therapist, who have conflicting schedules, or who are affected by the stigma of mental health and are ashamed to seek out treatment. Research is being conducted to whether these apps actually work and if they target specific mental health disorders and whether patients would actually effectively use them as a tool. This is Kevin. Kevin is a social worker, and this is how Kevin is going to help Alice. Under the Code of Social Work Ethics, the two principles we are focusing on is the principle for social workers' primary goal is to help people in need and to address social problems, and the second one for social injustice is social workers challenge injustice. Under the description of this, Alice perfectly fits in as the vulnerable, oppressed individual who needs help finding resources in her treatment of depression and a guide to the process of seeking out treatment. So this is the different levels of intervention that a social worker or Kevin can use to help Alice and her family. Kevin would help Alice on a micro level. This would be one-on-one personal interactions with Alice and her family. Kevin would help them find resources. In the future, this could be recommending a reliable app for treatment, but right now these resources would include transportation, child health care, inexpensive or free counseling, relief programs, recommendation of a specialist, etc. On a macro level, this would include a broad institutional level. This would be for a social worker or Kevin to examine the institutional root problems and finding a solution, or not only for the individual, but the whole community, organizations, or corporations. For mental health, this would include ending the stigma of mental health or providing resources on a greater scale for those who cannot seek out treatment. On a meso level of intervention, this would be focused small groups such as religious centers, local communities, school organizations. Regarding mental health, this would be finding resources for those who have suffered for something like a natural disaster or group tragedy. This would also be finding targeted resources for specific groups. Social workers in general, regarding mental health work in public schools, general and special service health care facilities, substance abuse prevention and treatment programs, child protective services, family service settings, and general long-term facilities. Social workers are also on the front lines, working in teams in a variety of settings to ensure that people are successful in their treatment and care for mental and behavioral illnesses. So what can you do to stop these issues is to stop the stigma of mental health in general. At home, you can encourage positive communication among family and friends on struggles they could be suffering from regarding mental health illnesses. Never encounter the situation in a negative light or tell them their problems do not matter or they should just get over it and it will go away. Always be open and inviting in conversation. Never shame anyone into feeling as though they do not matter, and stop acting as though issues of mental health are a joke or something to be laughing about. The only effective way to treat someone is to allow them to understand that it is okay to seek out treatment, and this starts at home.